Ladies and gentlemen, today I stand before you to address an issue that is deeply important. That is deeply important to every single one of us. Healthcare is not a luxury, it's a fundamental right. Yet, for millions of people around the world, the inability to afford medical care results in unnecessary suffering, preventable diseases, and death, even death. The time has come for us to ask ourselves, why are we still debating whether healthcare should be free for everyone? The answer is clear. Healthcare should be a universal right, accessible to all regardless of income or social status. Imagine being forced to choose between putting food on the table and paying for life-saving medication. For millions of people, this isn't hypothetical, it's their everyday reality. Whether you're insured, underinsured, or uninsured, the cost of healthcare affects us all. Rising premiums, surprise medical bills, and inaccessible treatment are problems that don't discriminate. After researching healthcare systems globally and looking at the outcomes of universal healthcare, I've come to believe that the current system in many countries, including the US, is deeply flawed and unfair. Healthcare should be free from everyone because it is a fundamental human right. It promotes a healthier society and it eliminates the financial burden on individuals. Today I will talk about the three key reasons why healthcare should be free. 1, healthcare is a human right, not a privilege. 2, the universal healthcare improves public health outcomes. 3, free healthcare reduces economic strains on families and individuals. Okay. The current health care system is failing millions of people. Over 30 million people in the U.S. are uninsured and even more are underinsured. Many delays or skip medical bills due to cost. According to the American Medical Association, the U.S. spends more on healthcare per person than any other countries, yet outcomes are worse. Medical bills are the number one causes of bankruptcy in the U.S. A diabetic patient without insurance may spend over $1,000 a month on insulin, something they literally cannot live without. Now that we have some insights on the problem and what can we do about it? Okay, the solution is to implement a free universal healthcare system. A fund healthcare through taxes like many other countries do. Nations like Canada, the UK, and Sweden have universal systems paid for through public funding, and their citizens spend for far less out of pocket. Shift focus to prevent care and early treatment. Free access to primary care can reduce emergency room visits and lower long-term healthcare costs. As stated by Marianne Mollman, good health is the foundation of a person's life and liberty. Injury and disease are always disruptive and sometimes crippling. We might have to stop working, cancel plans, quarantine, hire help, and in case of long-term disability, build a whole new support system to accommodate a new normal. Okay, free access to primary care can reduce emergency room visits and lower long-term healthcare costs. So we have cut administrative costs by streamlining the system. A single payer or government fund model reduces bureaucracy and waste from private insurance companies. But what would this look like in your life, in your community? Let's imagine the benefits. A free healthcare system would improve everyone's lives, not just the sick. Imagine never having to worry about affording a doctor's visit. You wake up with chest pains, you don't hesitate, you go get help. That decision could save your life. Without destroying your finances. Okay. Think about how it would ease the mental and fundamental load. Parents wouldn't have to choose between their child's treatment and the rent. See, communities would be healthier overall, fewer sick days, better productivity, and reduced spread of disease when everyone can get care. According to Lancet studies, found that universal healthcare in the U.S. could prevent 68,000 deaths every year. Okay, we've explored the urgent need for free healthcare by looking at the broken system we have now, a better alternative that exists in other countries, and the powerful benefits it could bring to individuals and communities alike. Healthcare is not a luxury, it's a human right. So today I urge you to raise your voice, support the policies and leaders who advocate for universal healthcare. Educate others, get involved with organizations pushing for healthcare reform. Because real change begins when we demand better, not just for ourselves, but for everyone. According to Nicholas Conley, healthcare shouldn't be a messy political fight to begin with. It's an issue of basic human rights, and what all too often gets lost in these scaffolds are the people most in need. No one should suffer. No one should suffer, go bankrupt, or die simply because they cannot afford to be healthy. A fair, compassionate society doesn't treat healthcare as a privilege for the few. It guarantees it for all. It's time to make that a reality.